Hello, I'm Tom Parker and welcome to Voices from the CEPS Ideas Lab. In this episode, I spoke with Louise Bengtsson. Louise is an Associate Research Fellow in the Global Governance, Regulation, Innovation and Digital Economy Unit at CEPS. Her research focuses on the EU's role in global health, including perspectives related to security and planetary health. During our interview, we discussed health diplomacy, improving health outcomes, collaboration between governments and international organizations, as well as the impact the Trump administration is having on the global health landscape. I hope you enjoy the episode.
Louise Bengtsson.
Well, Louise, pleasure to have you here.
Thank you. Pleasure.
I wanted to get into the topic of health diplomacy. What's the current climate around health diplomacy? What are some of the biggest challenges?
Yes, I think we're not lacking challenges. I had a main speaker in a panel yesterday say that global health diplomacy as we knew it is dead, or global health governance at least. So it's true, we might need a new approach to this. We're in no ways close to reaching the health goals of Agenda 2030. And I think with the Trump administration's decisions, we're moving even further away from that, obviously, with the effects of millions of people on the ground. But we'll talk more about that, I'm sure.
Yeah, so maybe let's go into a little bit more detail on some of those challenges. As you said, we're not hitting them. There are goals out there, but we're really lacking. So why and how?
I think there are many trends affecting health diplomacy that have been ongoing for a while. And one of them is a more turn towards geopolitical logic rather than development aid and solidarity, let's say, in global health. So we can see a withdrawal of, not only the US right now, but a gradual one of many donors, which is obviously affecting the support available for multilateral initiatives and health programs. So I think that that move to more strategic partnerships with countries instead of multilateral initiatives is one trend. And actually, it doesn't have to be negative. I'm just describing what is going on. And that's what the EU is doing as well with the Global Gateway, where health is one pillar of that, which obviously is an attempt to find synergies with local development agendas for vaccine production, for instance, or other things. But we can see this, dismantling a little bit of the traditional for us for health diplomacy. We can also see the emergence of new actors in this field. So, we see the rise of China. We see the rise of non-traditional donors from other countries, like the Gulf states, are playing a more active role, which obviously has also changed the logic a little bit, and also regional fora, not least in the African context with the African Center for Disease Prevention and Control and African Medicines Agency. So this is, this is just a description of what is going on, and it has obviously implications that are both positive and negative. It's a changing landscape.
Well, you mentioned strategic, a move more to strategic. Is that one of many new approaches to health diplomacy that needs to happen?
I think it is happening, no matter we want it or not. It is also a way to find, as I said, synergies with local development agendas, which I think is important. The African countries, now I'm generalizing, but like in sub-Saharan Africa, it was obvious that they couldn't rely on, the global north to provide them with vaccines during the COVID-19 pandemic. So what they want now is local production. So they're building that, and they're asking for support to maybe do that. That's why the EU's institutions are also there, as an example. So that is a change that we are seeing, and I think that's a good example of how this agenda can be, harnessed for something good. But I think there also needs to be a balance, obviously, between a strategic approach, where the EU is also leveraging health as a way to promote a broader agenda of strategic interests in Africa, because that's also what the Global Gateway is about. That's also what Team Europe initiatives supporting vaccine production is about, because the EU wants these allies. The EU wants to have good contacts with these African countries, right? Mm-hmm. It's an important continent, growing population and growing importance of these countries for many reasons. But to find a balance between strategic interests, but also I think adhering to some values in this is also good. Health systems is one example. Universal health coverage is something we often talk about in the field of global health, which is an investment in strengthening the health system of a country is a very effective way of, protecting it from pandemics, all kinds of health problems, and making it more resilient. Just an example of some kind of principles to be adhered to. So we're not only looking at security and short-term perspectives of strategic interests. Mm.
Yeah, I love that. And when we're looking at improving health outcomes on a global scale, what's the situation when it comes to collaboration between governments, international organizations, non-state actors? Is there a decent amount of collaboration that occurs? Is it creating a better outcome, or does there need to be much, much more? And how do you improve that?
I think what I hear from EU representatives when they engaged in more classical multilateral fora, for instance, the negotiations on the pandemic treaty within the framework of the WHO, is that we see increasingly a sense of deadlock and the sense that there's a tension between global north and global south. So apparently it's hard for the EU to get through with its priorities if it doesn't, become more in tune with LMICs, low and middle income countries, and partner countries in the global south. So I think, yes, there is increasingly a feeling of these traditional fora being, difficult to navigate. And these, as I said, these more strategic relations, bilateral partnerships, might maybe an easier way forward, perceived as more smooth. Mm-hmm.
Brilliant. Well, you mentioned President Trump earlier, right at the start of our first answer.
Yes.
How much of an impact will the Trump administration have on the global health landscape?
I think massive. It's already having a massive impact. On his first day, I think everyone knows that he pushed forward with the funding freeze for all U.S. foreign aid and the review, aligning it with the American First, policy, which has meant turmoil for this international, global system of health governance. Many institutions like the WHO, where the U.S. I think contributed to about 15% of that, institution's budget. That's significant, right?
Yeah.
They are in paralysis because they don't know which programs can continue and which programs cannot continue. The U.S. Recently terminated its agreement with UNAIDS, a big program they had there for HIV prevention, so which affects millions of people's access to life-saving medicines. So it's already having a massive impact, obviously trickling down to also local civil society organizations implementing policies, and eventually people on the ground who are relying on this for their lives. So I think that's a massive effect already. And yes, we will see what happens to the dissolution of USAID, but it is looking very bad, even though there are legal challenges also to his ability to actually eliminate that organization.
Yeah, I was about to say, is there any way of either plugging those deficits or to change those decisions, or do we just have to wait for 4 years until a different, potentially a different legislation comes in with a different government?
Yeah, that's a very good question. And while Trump's new administration in the security sphere, let's say for hard security issues, it seems to have a rallying effects on European countries coming together, a bit like after with Brexit, like we're in this together, we need to step up, and this time with military expenditure and so on. I think in the health field, in the development sphere, I see more difficulties for countries stepping up with money, with support, because we have this parallel security challenge, right? With defense budgets of European countries having to be ramped up. So I'm hoping that actors will step in. There's also philanthropy, obviously, that has a big role in this. Bill and Melinda Gates Foundation is a big funder of the WHO, so you might see these actors advancing as well, but obviously also China and others. So it's to be continued.
To be continued, and fingers crossed, very much so. Well, Louise, look, it's been a pleasure speaking with you. We should have had more time. There's lots to discuss on this matter, but for now, it's been an absolute pleasure.
Thank you so much.
Take care. Bye-bye.